right. Welcome to Dr. Z PhD Interviews, the place for interesting and inspiring people. Today's special guest is Ethan Patron. Ethan is trans advocate and also a public figure and a speaker, as well as COO of Breaking the Binary. Welcome to Dr. Z PhD Interviews. Thank you so much for being here.
Thank you for having me. I'm very excited to do this with you.
Awesome. Great. So for starters, why don't you share a little bit about yourself? You're welcome to share this point, how you identify, your background, just a little bit more information so that the viewers can get familiar with you.
Yeah, so my name is Ethan. My pronouns are he or they, and I'm a transmasculine, non-binary person from Peru. I was born in Lima, Peru, and I came to the United States when I was 11 years old. As an immigrant person, English was not my first language, so I had to learn about like cultural and the language. And so at first it was really difficult to sort of like acclimate into this culture. But now I feel, right at home. I started my medical transition when I was 23 years old. I'm 32 years old now. I'm happily married and I have a dog.
I know you're very happily married because I just had an interview this morning with Edison, your partner, that amazing interview, which will be showcased before. So for those who are watching, Ethan is referring to Edison Ross, an amazing, amazing person. Both of you are amazing. So now I know you best, of course, from St. John's. That's how you and I met when you were a patient's advocate at St. John's Transgender Healthcare Clinic. And now you're working at UCLA Transgender Health. How did you get in the field of, transgender health and especially being on a front line as patient advocate?
Yeah, so it's actually kind of interesting because back in 2015, I met Bambi Salcedo back in 2013. And she referred me to a clinic for my medical transition. And I ran into her at community events and she told me about Angels of Change. And Angels of Change is a yearly fundraiser for Children's Hospital. And they do a runway show, they do a calendar release. And so that was the first time I've ever done anything around my identity and to be a visible person. And the whole experience was just so uplifting because I got to showcase who I was, and people, just walking down the runway and seeing people cheer me on was just really an unforgettable experience. And learning more about Bambi and what she did, she used to work at Children's Hospital. And so just being so inspired by her advocacy and her work, I wanted to do something similar. At this time, I wasn't sure what I wanted to do, but I knew that I wanted to be involved in community somehow and support other folks like me. Forward to 2017, I had been sitting on different boards. I had made friends in the community. I was more connected. And I went to St. John's for my medical transition. And when I started going to St. John's, this was back in 2015 when they had just started their trans health program. And they only saw trans patients twice a week on the clinic on 28th Street.
Downtown LA.
Yeah, in downtown LA. No, actually, it was in South Central. It was in South Central, yeah, or South LA. And they didn't have the program that they do now. And that's where I met Aiden Kennedy, and Aiden Olson Kennedy and Lyle Cook, who became my primary care doctor. And then I ended up going to Kaiser because of work. And then I somehow ended up back at St. John's, and I went to my appointment and I saw Dr. Cook, and I started talking about what I wanted to do, and he recommended me to Diana Feliz Oliva, who at this time was now the program manager. And he told me about, they needed someone to fill the position, and he thought I was great for the position. And so I said, hey, why not? I applied. And the first time I did not get the job for like an HIV advocate. But then Diana said, you know what, you're actually better off at a patient advocate because I see you more behind the scenes, but also doing like direct patient care. And
Mm-hmm.
I was like, okay, I'm up for the challenge. I can do it. And in 2017, I was hired as a patient advocate. Um, Through that work, I learned about insurance navigation. I learned
Yeah.
about medical coverage, hormone therapy, and insurance, and how that is all connected. And it's really unfortunate because insurance is, they will deny your hormone therapy because it's not medically necessary. And I think it needs to
Really?
be,
Hormone
yeah.
therapy?
Yeah, so they
Really?
deny it and you have to request a prior authorization. And that's when they approve it. But it's a whole thing. Like you have to like say, hey, I'm a trans person, I need this. And that's what I did. I advocated to insurances to get our patients their medication, their
Mm-hmm.
surgery. And back in 2017, Medi-Cal was only really approving breast augmentations and vaginoplasties and top surgeries.
Yeah.
But, facial reconstruction was not a thing. Body reconstruction
Mm-hmm.
was not on the map at all. And it was through St. John's that we reached out to Medi-Cal and we formed connections with LA Care and we
Mm-hmm.
advocated for the approval of these medically necessary surgeries. So I left St. John's in 2019 and feeling just really proud of all the work that I've done because we helped shape what is covered now by
Yeah.
Medi-Cal.
That is
And
incredible.
thank you.
Incredible. I did not know. I did not know that State John's was solely responsible for connecting with LA Care and making sure it covers, at this point, LA Care covers everything, which I
Mhm.
think is phenomenal. So you are the person behind the scenes who was probably working really hard, making those connections, making that happen. What an incredible amount of work you put in.
Thank you. I mean, as a trans person, I know that these surgeries are life-saving.
Yes.
And I was not just being a patient advocate, but I also formed connections with my patients. And I saw how important it was for a lot of the girls at St. John's. They needed this.
Mm-hmm.
And I wanted to make a difference. I wanted to help. And being there for almost 3 years, I felt like I had reached my time to move on to something else and still be in trans health. And I was actually recommended by another colleague for the UCLA Trans Health program. Um, and so Christopher Mann, the program manager, was aware of who I was because of the work I did at St. John's.
Mm-hmm.
And they had also seen me present on Medi-Cal and insurances and surgeries back at the Keck School of Medicine. Yeah, so they knew who I was. And so I guess as a result of my work, they knew that they wanted to work with me. So I applied, I was hired, and now I'm working for UCLA.
That's amazing growth you've done from St. John's to UCLA. And you and I, of course, connected at St. John's. When I went to St. John's, when I moved to Los Angeles, and I said, it was probably around 7 years ago now, and I said, hey, I work with this community. I do evaluations letters for free. And you and I started collaborating because you actually started sending people my way to get those evaluation letters completed that they needed. And then
Yeah.
that's how our paths has crossed. So you've been on this front lines of patient advocacy in Los Angeles, right? Starting with St. John's when I started building this out from 2015, now at UCLA, and you've seen it all in terms of insurance coverage, denial, and you've probably seen it now at UCLA, you're seeing it especially from different insurance carriers, not just LA Care, right? Blue
Mhm.
Cross Blue Shield, Anthem, you name it. What is the biggest barrier do you see the trans communities faces when it comes to getting coverage?
Well, there are, so when we're talking about insurances, Medi-Cal covers every like surgery for free. There's also like economic barriers. There's also housing barriers because folks under Medi-Cal only make a certain amount, right?
Yeah.
And so these barriers, while you can get your surgeries, these barriers also get in the way of having your gender affirming surgeries. When you're
Yes.
thinking about housing, and you want to recover,
Mm-hmm.
where are you going to recover if you don't have a place, right? So I feel like socioeconomic barriers are one of the things that our community really needs support with. In terms of like insurance coverage, I know that a lot of PPO insurances will cover surgeries. And generally, PPO insurances are given to you by your employer. You know, it's like really, really good
Mm-hmm.
insurance. They between like Medi-Cal and PPO and HMO insurances, it's all the same in a way where you have to put in the prior authorization,
Mm-hmm.
and if you get a denial, you can overturn it. But
How
I will say,
often, sorry to interrupt, how often do you see initial denial as just being insurance, basically initially just doing it automatically, and then upon appeal or secondary application approval? How often does that happen? Because I think a lot of people don't realize that that's actually does happen and it's a thing, and they just give up.
yeah, so I know that some folks under PPO insurances have gotten denials for revisions of surgeries, 2, 3 denials, and sometimes they have to do a peer-to-peer um, conference between their doctor and the surgeon and the insurance.
Mm-hmm.
But they do cover at the end. What I've seen is having those denials turning into approvals. It is a process. Sometimes it's a lengthy process. It could take a long time, but there are resources to get those denials into approvals. And also there's other other programs that help
Mm-hmm.
folks that do get denials. I think I'm thinking of like Lambda Legal
Mm-hmm.
and yeah, places that will advocate for trans folks as well. But as like a base, the insurances do deny claims for hormone therapy based on the gender and the medication, which I mean, sorry, the sex and the medication, which is ridiculous, right? Because if you're seeing someone with diabetes, you're not gonna say, "Hey, prove to me you're diabetic." It's actually,
Exactly.
given to them. So I feel like maybe that needs to change, and we need to move in a direction where we are not encountering denials, because sometimes it does take a while to get your hormones, and that could really impact someone's mental health,
For
physical
sure.
health. So
Mhm.
hopefully we come to a place where that's not a thing in the future.
Yeah, no, for sure. I think especially when it comes to to hormones, that's why you saw such a demonstration of surprise on my face, because in my experience, that's something that I know that there's some places that require still a letter from a therapist, which is completely ridiculous. But usually with a doctor going, especially in LA, with informed consent model, going and talking to a doctor, usually you do get your hormone prescription. But I guess what you're saying is that yes, doctors will give you hormones, but whether the insurance will cover the coverage of the hormones are two different story. And I agree, it's a very dehumanizing and demoralizing and in a way abusive system.
Yes, it's
Mhm.
very outdated, and I hope it changes. We're just trying to be and exist. We need our medications. So
Yeah.
I'm glad that there are programs like St. John's, like the LA LGBT Center, like UCLA, that do have these programs where trans people can come and have access to their medication, to health. So yeah.
Yeah, and having people like you who are gender diverse behind the scenes helps tremendously, because you understand first and foremost what people are struggling with, versus somebody who may have an idea but really not have experience. Now, you also a CEO of Break the Binary, and Edison and I talked earlier quite a bit about breaking the binary and the message and mission behind the company. I'm curious to hear from you. Now, understanding what the mission and everything is about, do you, in terms of language, do you find that language is actually quite problematic in a sense when we use the words such as trans man and a trans woman? Do you feel that that type of language continues to perpetuate the binary point of view?
Um, I mean, it depends on the setting. I feel like medical settings, the language that is used isn't the most recent language,
Mm-hmm.
or like language that is used in community, and that's valid because these are doctors, right? They don't know how to speak to their patients. Um, but I do feel like there needs to be education around language and what words to use. Um, and yes, we live in a binary system, but I feel like there's room to learn additional language to support your patients, to support your
Mm-hmm.
community. Working with Addie and Break the Binary has taught me that even my own preconceived like notions of gender have shifted.
Yeah.
And when I met Addison, I was identifying as a trans man, but I never really felt comfortable with that label because I
Mm-hmm.
knew that for me, man didn't make sense, right? But I didn't know that I could still be a masculine person and not identify as a man. So I learned about my own gender through this journey with them because they were non-binary, they were proud of who they were, and um, there's just so much deconstruction of gender that happened along the lines of like like sexual orientation, gender identity,
Mm-hmm.
and my own identity as well. So yeah, it's been interesting, and I'm more comfortable in my skin now than I was 5, 6 years ago.
That's great to hear. Yeah, when I was talking to Edison, they pointed out that your gender expression has expanded and has changed as a result of your own exploration and having a safe space. And they also pointed out that when you go out, it's for you, people just automatically read you as cis male, period. And I was wondering, for you, I was being to ask, as somebody who identifies as non-binary transmasculine, does that affect your role? Does that bother you at all that you're being boxed into a binary point of view?
It's it depends. If we are if we were to travel and we're in a place where I don't know anybody, I feel like it's a safety thing for me.
Mm-hmm.
Um, but when we're in community spaces, I feel like I have to come out all the time, like, hey, by the way, I'm trans. I'm a non-binary person, which does get tiring,
Mm-hmm.
and I mean, I guess that's how people are sort of brought up. You look at someone and you assume their gender identity, so it's sort of like straying away from those notions of gender and who the person is. But
Mm-hmm.
I mean, we we have been at different, spaces like Pride, and I'm not wearing a shirt because I'm proudly see I want them to see my chest, right? My scars. And I've done that too when we're, at a club, and I will like open my shirt up so people like know that I'm trans. Because I think for me, my identity is not who I am, but it's
Mm-hmm.
part of who I am. It's it's not everything that I am,
Mm-hmm.
but
Mm-hmm.
I'm very proud to be a trans person of color, to exist, to take up space. Um, so I mean I guess I navigated differently in
Mm-hmm.
different settings.
Okay. In terms of the world not being, I don't want to say not ready, that's not right, but in terms of the world not having societal cues for non-binary identity, right? That's one of the biggest things I see non-binary people struggle is that when they go out there, people misgenders them, either male or female, and they don't feel like they're either one of those. So for you as non-binary individual, is that challenging at all that there's no societal cues, or do you feel so affirmed and so confident in your own identity and expression that other than minding your safety, it doesn't really matter?
It depends where I am. It won't matter if like I travel to Peru, right? If I were to go there, I would not want to be read as a non-binary person because
Mm-hmm.
there's just so much work to do. And it's not
Yeah.
safe. It's really not. We're still not in a place where people can have their name and gender change. So
Mm.
it's difficult. Here in Los Angeles, um, I do feel privileged to have that safety and say, hey, I'm non-binary, like this is who I am. Um, and yeah, I mean, I know that I'm privileged, and I know that I have the ability to navigate the world um, in a setting where, like, if I'm not read as trans, that's fine. But if I am, like, it's also fine, you know. Um, so there are factors to consider with that.
Mm-hmm. Yeah. So you also been, as we talked earlier, you've recently married to Edison. Edison and I talked about it. Congratulations on both of
Thank
you.
you.
And we discussed the reason behind the marital bond. And it sounds like it was much more pragmatic and practical. For you personally, have you noticed any shift in your relationship as your gender has evolved and as your own relationship to gender has also shifted over the years?
Yes, absolutely. Prior to Addie, I had only been in binary relationships or same-sex relationships.
Mm.
Um, when I started my medical transition, I was pushed towards a masculine, more like in a box where I had to be a man, whatever that means, right? Like be more tough, work out, like, and
Mm-hmm.
although that's not what makes a man, like it was just like you have
The
to
stereotype.
stereotypical things, right?
Yeah.
Um, and I was not happy with that. And so I got to a point where I just didn't want to be around people anymore because I didn't know how to be.
Mm-hmm.
Um, it was like, yes, I was a trans person, but it still felt like I had to perform my gender.
Mm-hmm. Mm-hmm.
Um,
Interesting.
and so I meet Addison, and we, as we got to know each other, our conversations around gender sort of helped me understand that there is no one way to be non-binary or to be binary. Like that doesn't, your gender is your own, right? And
Mm-hmm.
even cisgender people, they're never going to be the same.
Yeah.
There's no two of one person. So for me, I guess my relationship with my own gender identity has become healthy, and I don't feel like I have to perform gender because I'm just being me, right? And whatever that is, that's Ethan, right? My energy, who I am
Mm-hmm.
inside, my values, and so all of that makes up Ethan. It doesn't, whether I'm non-binary or binary, I'm still like like a soft
You're
person. And
more than just a gender. You're much more holistic as a person.
exactly. So being married to them has also been really really cool because I never thought I could get married. I
And now you guys are also thinking about family, Edison said.
yes,
Yeah,
we want to have kids.
that's great.
And I I was someone who didn't want a family, but if I did have one, I knew that I didn't want to carry a child.
Mm-hmm.
There was just so much dysphoria around that, and
Yeah.
oh, that's not a masculine thing, and just random ideas about like what it means to be a parent. And so now I'm in a place where that's my thinking has shifted, and I would love to become pregnant one day and experience that journey.
Yeah.
If I have the equipment to do it, then I would love to experience it, and it doesn't make me any like less of anything, or I'm not confused about anything. I just want to be a parent, and I think parenthood, um the typical or like the binary um way that people describe parenthood is like a mom and
Mm-hmm.
dad.
Mm-hmm.
Well, that works for families. There's families like ours that doesn't exist, and
Mm-hmm.
we wouldn't even force gender on our kids. They will figure that out on their own, and we would just love them. It's just so much. I don't know if my family didn't assign gender to me, I would
Mm-hmm.
have been myself a lot sooner, and it would have saved me all the trauma of having to navigate society as someone that I wasn't.
Yeah.
And I felt like that set me back so much. But now I'm back to myself, I guess.
It's incredible to see in both you and Edison narrative the unlearning process unfolding itself, the way both of you are constantly unlearning the binary way of relating to the world, not just gender. I think that's very powerful for people, because I think even when people do transition, if transition is for them, there's still that binary concepts that are continue to perpetuate. Now, you said something that I found interesting. You said that when you were first identified as a trans man, you felt a pressure, you felt a push in order to perform the stereotypical, or to be presented as a stereotypical man. Where did that pressure come from? Because I find it so interesting. You mentioned that it felt like you were performing, like gender was a performance, which is usually we hear from people who are pre-transition. They feel that living in their biological assigned sex or biological assigned gender is a performance. And you're actually saying that, no, for me, starting out and presenting as a trans man felt like performance. So where did that push come from?
I guess for me, it was that for a long time, I was labeled as a woman, right? And that was performative in itself. I was
Mm-hmm.
just navigating the world, and I didn't like being associated with women. And so back in 2013, when I started my medical transition, I didn't know that there was more than men and women, right?
Mm-hmm.
And so I was like, okay, I'm not a woman, so I must be a
Mm-hmm.
man. And that's when, I mean, I love the physical changes that came with testosterone, don't get me wrong. I loved the way I look. Um, I also didn't like, I like pronouns he and him. Um, I just, it didn't, something about being called a man also just didn't feel
Mm-hmm.
like it quite fit. Like the puzzle was coming together, but
Right.
there was still some missing pieces,
Mm-hmm.
right? And then I felt like I wasn't masculine enough. And so like I needed to do extra things to compensate for that lack of masculinity. And it was all in my head too. Um, but yeah, so from that, um, unlearning behaviors that were harmful for me came from being around like men, and there's a culture of toxic masculinity and bonding over that, and
Mm-hmm.
that is common, you know. And I didn't like it, but I was like, okay, so this is what I signed up for though, right? So this is what I have to do. And um it just didn't feel right, you know.
Yeah.
And so after being okay with my body, I still experienced a lot of dysphoria because I was like, well, I need to be a man now, so I need to have X, Y, and Z, right?
Mm.
And yeah, that sort of threw me back into a depression. And talking with Addie and getting to know them,
Mm-hmm.
I was around more non-binary people, and it, it just sort of felt freeing. A label that is so freeing, and
Yeah.
it can be whatever you want it to be, right?
Yeah.
At least for me, because I know there's a bunch of binary folks that are friends with us, and they experience their gender in a different way than I did, and they're happy, right? For
Mm-hmm.
me, that wasn't the case.
Yeah.
Um,
Yeah, you seem to be, your path is a great example of somebody who initially started identifying as transbinary, and by exploration and especially learning the spectrum of gender expression, gender identity, you realize this is not exactly sitting it for me. Because we often talk about non-binary individuals identifying as non-binary, and then realizing that there may be more in a binary, more trans-binary, but you're a great example of actually identifying as trans-binary and realizing, no, this still doesn't, that's the only option I had at the time, but now that I'm realizing there's more. So it seems like breaking out of that box, that limited, and I think that the binaries in itself are somewhat limited, right? Breaking out of that box and realizing you fit more somewhere in the middle of a spectrum seemed like it really helped you
Yeah.
to embrace your body and
Yes.
embrace yourself, and not only the masculine sides, but also all the other aspects of yourself, and not feeling the societal pressure of being this idea of a man.
Exactly. And my gender euphoria just comes from embracing all the parts, the masculine, the feminine, like everything. Like I don't feel like I have to stand a certain way to be perceived as Ethan. Like I can stand however I want. I can wear whatever I want. I can dye my hair pink and I'm still, me. Like it doesn't, yeah, it allows me to experience gender in a completely different way. And I will say that like with me, I used to experience a lot of like body dysphoria, and now I don't.
Mm-hmm.
It's like I like who I am, and I'm really happy how far along we've come. Me and myself, myself and I, we've come so far, and it's been a journey. But I wouldn't be where I am today if it wasn't for all the people that I've met,
Mm-hmm.
all the binary folks, and even my own binary experience as a trans person, like it all just helped me evolve into who I am today.
That's great. Now, you always strike me as a person that has a lot of confidence. Just looking at your Instagram, your
Really?
photographs. Yes, is that not true? Did I get that wrong? The pictures are, I was commenting earlier about Edison's Instagram, both of your Instagrams, both of your photos, especially you have this satiric way of posing, almost as if there's something comical going on, but yet it's serious.
Yeah,
It's almost says a message. I don't take myself serious, but I kind of do.
yeah.
And it breeds a lot of confidence. And you're often very confident about your chest scars. You're very comfortable about your body. It's very clear in all of your shoots. Where do you feel that confidence? Do you feel like you really encompass that confidence that projects in the images?
It's the Leo in me. I it's awesome to hear that because I didn't see that. But when I do take a picture, there are days where I'm like, oh, this is not good. But most of the time, I do like the way I come across. Um, and even now, I still see changes in my physical appearance, and it's been an interesting ride for sure because I get really shy sometimes, and I have a terrible fear of public speak that I get into my head. I'm like, oh my God, what are people gonna say? What if I forget what to say? So when I'm in front of a camera, I sometimes like sort of like freeze a little bit, but I'm like, nah, dude, you look good. You're gonna do this and you're gonna have awesome pictures.
It does
So
not show. It does not show. And I know that you're also a public speaker. The pictures, it does not. And I'm going to try to snatch some of those photos out of the Instagram and insert them throughout the interview for people to see what I'm referring to, because it does not show the way you carry yourself. It's a lot of confidence. And I think it gives a lot of people confidence out there looking at your photos. I think there's a lot to be proud of. I think I agree with you. Gender is not all that defines who you are. It's just a part of who you are.
mhm.
So a whole holistic approach is really, really important. Now, in terms of your own gender evolution, um, up to this point, what have you found to be the most challenging thing?
Breaking like preconceived notions of what it means to be anything, right? Like I was like, well, am I non-binary enough? Like, am I?
Mhm.
And I was like, no, you are because you exist and you are non. That's all you need, right? Um, it's just a lot of society putting people in boxes even now.
Mhm.
So
Mhm.
having to break through that has been challenging, but also it's about learning, right? Like the continuity of learning what it is to be myself. Um, I'm not someone who I was a year ago, and a year from now, I'm not going to be the person I am today,
Mhm.
right? So it's just that constant evolution and knowing that it's okay to change. It's okay to want change, you know, otherwise you're stagnant for me.
Mm-hmm. Mm-hmm.
Um, and just welcoming change, I guess, you know, and um being open to having conversations around this, being open to learning from other people, meeting folks and meeting them where they're at. That has been challenging as well, because not everybody's going to agree with you, and sometimes I
Right.
get in my head like, okay, but that's not right. But you know, I was someone who didn't have it all together 5 years ago, right? And my perception of things were completely different than where they are today. And so just I guess accepting that, we're all different and
Mm-hmm.
we're all great in our own ways. And at the end of the day, I have to do what makes me happy, and I just want to be authentic with myself.
Well, authenticity definitely comes across when I talk to you, when I interact with you. So it's definitely something that you have. It seems like unlearning a lot of gender constructs and gender boxing, the limitations of the gender, really not only help you embrace yourself, but also feel more confident in your body. Do you think that for people who are, even who identify as trans-binary, but who for whatever personal and a lot of other reasons are unable to get surgeries they need to feel more congruent, and maybe some people sadly will not be able ever to get surgeries because of the medical conditions, what kind of tips can you give them to unlearn? Because it seems like this unlearning these paradigms can also help them see their bodies differently, see their even their binary gender differently.
Mhm.
What are the tips you can give in terms of how to unlearn that?
For me, it was a lot of, um, for me, it was being around community and forming relationships with our friends, and having dialogues around our own gender, right?
Mhm.
That helped me understand just how vast the possibilities are. And that helped me understand my own gender, right?
Mhm.
And so I would say that if you're in a place where you're struggling, you know, find some community, find folks to talk to, because it's good to have that community support.
Mhm.
On the other hand, you know, if you're wanting to look a certain way, um, try to do things that you can, like, I don't know, for I can think of, for like trans folks who want top surgery, you know, work out, you know, do things that you can. There are binders that help alleviate gender dysphoria when it comes to your chest. Um, so yeah, I would say there are community resources that folks can access. There's, now that we're in a place where COVID is present, there's a lot of
Mhm.
online support. And I met a lot of friends through Instagram, through you know, just different various online platforms that have helped me build that community.
So to sum up our interview, I'm curious to know right now in your life, where you at right now, what are you the most looking forward to?
At this time, right now, I am looking, personal notes. I am looking forward to December, vacation. Me and I are gonna go on vacation, and we need it. We've been working so hard,
Mm-hmm.
and I just kind of want to disconnect and unplug. Um, on a community level, I'm looking forward to more programs existing that cater and help trans and gender diverse folks. You know, I feel like every doctor needs to be educated on trans health, because you
Mm-hmm.
never know who's gonna walk down your door.
Yeah.
And then yeah, I don't know. I wish well and prosperity for my trans folks.
That's a great thing to look forward for you and Edison are going.
Yeah, we're gonna go. We're deciding where to go for Christmas. So we are looking forward to traveling somewhere where there's a beach and it's just the two of us.
So you're gonna go from sunny California to another sunny place.
Yes.
Usually people, I don't think you realize that usually people travel from cold climate to warm climate in December, or they travel from cold climate to get snow because we don't get snow in December, but you're actually going from one sunny place to another.
I love the sun. I'm a lizard.
Yeah, I think both of you do. I see a lot of pictures of both of you sunbathing or being out and about. It's always great to see both of you doing those activities and those things. I definitely wish you to have incredible rest and have lots of travels and get plenty of that respite time that both of you need. Thank you so very much for being part of the interview. Thank you for taking time out of your day to sit down with me. And I'm definitely going to be looking forward to you and Edison forming a family in the future.
Yes, thank you so much for your support and who you are as a person. Like, you're just so wonderful. And I'm really, really, really thankful for everything that you do.
Thank you, Ethan. Thank you.